Hey, NC girl. Let me see. Who on it? Bet on me, why not? Don't act like it. Hello, hello. Welcome in, y'all. How are y'all doing? Who on it? Hello, hello. Welcome in. How are you all doing? Hope you're doing wonderful. My name is Medina. I'm sorry, y'all. I'm looking at something over here. Founded owner. She say he say LLC. Hey, certified one. How you doing, love? Let's see. Yes, Lord. Yes, Lord. How is everyone doing? I hope you all are doing wonderful. Because I am doing wonderful. Yes, Lord. I've been gone for a little bit because you got to take your breaks. Okay, sometimes you got to take your breaks. This social media thing is a lot going on. Y'all got a whole lot of hey love. I got a whole lot of windows up in here, so the natural sun is coming through, and I'm gonna let it come through. I'm gonna let it come through because you need the vitamin D. If you ain't taking the vitamin D orally, you need to get the vitamin D from naturally from the sun. Okay, so I'm gonna let this stuff come on through. Hey, well, Harvey, how you doing, love? What's going on? User number? How are you doing? Yes, God. So today I was planning on talking about because October is Breast Cancer Awareness Month, and so I'm gonna get into it a little bit. And I'm gonna have someone come. Well, Harvey, I'm gonna have you come in if you don't mind. But thank y'all so much for following. I appreciate it. Um, you know, but other than that, like I said, I hope everybody mental is doing good. Hope everybody is doing wonderful, mentally, spiritually, physically in alignment. Um, this is a safe space. Okay, if you feel as though you can't control what's gonna come out your mouth and it's gonna be disrespectful, you got 10 fingers and you got 10 toes. Take all 20 of them bad boy all together. 10 plus 10 is 20 and swipe your ass up to the sky. Okay. Hey, people in the sky, how y'all doing? I hope y'all doing wonderful. Okay. That's what you do, but it won't be no disrespect going on up in here. Okay. I just want to let you guys know that and whatnot. But hopefully everybody doing good. Everybody doing wonderful. Everybody mental is good, whatnot and everything, you see, because God. And if you wanted to know, hey love, if you wanted to know where to find this beautiful sweater, yes, God, this is the part of my labels collection. Go to shop at shesayhesay.com. You can click it. I have a link tree in my bio. You can click in the link tree. It's the last link in the link tree. Shop at shesay.com. And it's $25. It comes in black and it comes in this color here. Okay. I also have the t-shirts as well. So definitely check them out. Let me put my glasses on and whatnot, because we're gonna get into some things. And some things is what we're gonna get into. Yes, God. I can't find my other glasses, my trifocals. I don't know what I did with them. I don't know what I y'all. I got regulars. I got these are bifocals and I got trifocals. I don't know what I did with my trifocal glasses. I don't know if I left them in the car. They've been missing now for about 2 days. I remember taking them out, but I don't know what I did with them, Lord. I don't know what I did with them. My God, today. Yes, God, thank you so much, Harvey, for coming into the room. We blind. Yes, listen, friend. Listen, girl. Look, you know what I'm saying? Because I'm going to be down here all forehead. Me and my forehead going to be down here like this trying to read what's going on. Okay. So it's not just me. It's three of us right now. It's me, my forehead, and Harvey. Okay. It's three of us right now. Yes, God. See, she trying to cover her forehead up. Really, it would be four, but she trying to cover her forehead up. But it's okay though. It's okay though. Uh-huh. You see, so sometimes your forehead is a human in itself. Okay. Amen. Mm-hmm. Amen. Hell, I got my own my contacts. I don't know about the contact thing. I can't do trying to put something in my eye. I can't do it, child. I can't do it. Well, thank y'all so much for coming through. And I'm not gonna be on here long. Don't y'all hate when people say they want to be on here for 2 and 3 hours? Well, that's how I be sometimes. Okay. Sometimes you don't know what direction the conversation gonna take. Sometimes when somebody is coming in, especially if somebody want to come in and talk about their testimony or their story or what's going on, I like to let that flow because I feel like that God, you know what I'm saying, lead people to certain situations. So I'm never going to turn somebody away. Like I said, as long as you're respectful, that's all that matters. Okay. Mm. But definitely I got to push through. Cause Lord know, hey, Sydney Cat, I got to push through. My God today. Yes, Lord. But I wanted to come on just to emphasize, like I said, October. Well, welcome in everyone again. My name is Medina, founder and owner She Say He Say LLC, and I have Waharvey here with me as a special guest. And like I said, the platform is open for others. I wanted to touch base some on breast cancer awareness because this is Breast Cancer Awareness Month. Hey, love, how you doing, Kim? It's also Domestic Violence Month as well. So definitely my heart goes out to anyone who have battled breast cancer, who have, like what Harvey has said, is a conqueror, a breast cancer conqueror, not survivor, but conqueror, as well as anyone who may have, who have those, rest in peace. And those who in domestic violence, those who've overcame domestic violence or may currently be going through something, okay? Yeah. Our heart goes out to you and praying for you and praying for protection, you know what I'm saying, and everything like that. And so I'm a registered nurse, while Harvey is as well. And so Harvey is a licensed practical nurse, but we nurses. Period. Okay. We nurses. Yes, God. When you can delegate to others, that's what it is. We nurses. And so what I wanted to do and what I aim to do with my platform is not only promote my business, but also promote, providing education, providing preventative, information for men and women, because men also can also be diagnosed with breast cancer. Mm-hmm. And so I don't even think it's really rare like it used to be, you know what I'm saying? But I'm gonna get into some statistics and evidence-based practice. One thing I will tell you, whenever I'm on here discussing anything related to health and wellness, I'm always going to use credible resources. Okay. Now I know some of y'all might not feel too well about the CDC, but it is what it is. All right. There are other resources as well that you can use. But again, this is what a credible resource is, and this is what I'm going to be using to help guide this conversation and just kind of, talk about some of the things and testimonies people may have. Okay. Mm-hmm. But thank you again, Walt Harvey, for coming in. I appreciate it last minute. Mm-hmm. And so I had planned on doing this today at 5:30. And then y'all already know sometimes, Lord Jesus, sometimes that laziness sink in, but then something said, no, God said, get up. Get yourself together. You've been chilling for a little bit too long, and come on through here and do what you need to do. So I got to do it. You understand what I'm saying? When he say, come on and move, I'm moving. And so, and so I do want to say that, and I just recently had my mammogram, as well as my pap smear, my annual pap smear. Ladies, get your annual pap smears too as well. Okay. That's also important for you to get those as well. If you haven't already got one, please make an appointment to get one. And also reach out to your local public health department. Some people don't know, but public health is not only for you to go for Medicare, Medicaid, food stamps, and things of that nature. They also have clinicians there, okay, that can do, if you can't afford, you know what I'm saying, medical insurance, you can go there and fill out an application and they can determine what you qualify for, or it may be maybe no cost based on your income, or it may be at a reduced rate. All right. But they also do maternity care. at the public health department. They also do those pap smears. I think a lot of women don't realize we still need them after. Yes, we do need them after menopause, because people don't understand. You still can attract certain types of things. You know what I'm saying? So that's a good point, Keisha. Welcome in. I don't think people do, and you really do need to be getting them. You see what I'm saying? Because I asked my doctor, because I'm cramping. I ain't drink a lot of water like I should have, y'all. So my cramps and my period this month was off the chain. You see, that's what done had me down. Okay, nauseous. I don't know what, y'all. I was so nauseous, and ooh, Lord. And when I went to my doctor's appointment, I said, well, when I'm 44, I said, so when am I supposed to start hitting menopause? Well, I'm going through premenopause. I'm early, but that's when I am going through. Because my periods are not regular, but everything is fine. It's just they're not regular. Now, she said around 51 is when 51 is when menopause tends to kick in. However, always consult with your doctor if you're over 51 and you still are experiencing, you had a hysterectomy, Keisha. Oh, okay. If you're over 51 and you still experiencing a menstrual or having other issues going on in that area, definitely reach out to your gynecologist, okay, or your primary care doctor. All right. I'm telling y'all right now, any little feeling of your breast or any feeling that you're having in your abdominal area, that cervical area, like right there in the folds of your thighs right there, or in the back, definitely reach out to your doctors, y'all. Okay, reach out to your doctors about that thing. Definitely do. Because I'm telling you, it's I don't want to wish nothing on anyone, but it's better to know than not to know, or find out that you in a stage to where there's no going back. Okay, so definitely, do that. And so, with your breast cancer screenings, they definitely have. So how many people who in the room or in the sky? I know y'all ain't gonna drop down. Do your own mammogram, do your own breast examination. So my doctor, it's no longer circular. Did y'all know that? You remember back then they used to teach us to do it in your arm and start up in here and then do it in a circle. It's now zigzag. And see, I didn't know that until I went to my recent appointment, and she said you start here up in the upper arm, up in here, and then you come and you zigzag. That's how you do. You palpate and you zigzag, and then you try the other arm. Now, the purpose of that is to look for lumps. You see what I'm saying? So if you notice that in one arm there's something going on, but in the other arm, it's not that same thing, then that's definitely something where you want to reach out to your gynecologist, your primary care physician, and everything like that. Yeah, they sure is different. I didn't know that. I thought it was still circular or whatever and stuff like that. So, and you don't have to do it in the shower. That was something also that they taught us as well. You can just do it pretty much, lay down on a flat surface, hold your arm up above your head, start here in your arm. You see your lymph nodes and stuff. You got to start in your arm, up in here in your underarm first. That's where you start, and then not just in this area. You're gonna start up in this arm, up in this area here, and then you're gonna zigzag and palpate and go down until you get, and then you try to go with the other arm. So definitely, that's something I didn't know, but that's the way that you should be checking on. Every month, checking. And if it's during your cycle, if you have menopause, of course, you probably want to just try to take a day out of the month and check. This is my first time hearing this. Hey, Leona, yeah, Chad, that's my first. Yeah, I didn't even know either. I thought it was supposed to be, the circular motion, but she was saying, you start up in the upper arm fold, because that's where you can actually feel. You see what I'm saying? Something that's, that's going on as well there too. And something I've also explained as well is that the mammograms are uncomfortable. If you haven't had one yet and you should be getting one, I'm going to tell you now, they're very uncomfortable. But I'd rather go through that. My God. I'd rather go through that than to have it, okay? That's why it is so important, y'all, to get these preventative tests. That's why I come on here like I do. You see what I'm saying? You're welcome, Leona. I come on here like I do to explain these things because it's very important. It's very important. So definitely, and also when you have your first mammogram, don't get scared if they call you back and want to do a 3D or something more extensive, because
Right.
that's what happened to me. Typically on your first time, when the doctor don't know your norm, and if they notice one breast is bigger than the other, or one breast have more tissue in it than the other, they're going to send you to have a more extensive mammogram to really determine if it's anything going on. Once you do that, then the doctor is familiar with how your breasts are. So then they know
Mhm.
moving forward, okay, this is your norm. So then anything outside of that is where, they may have to look into some other things when you go to your appointment. So if it's your first time going, don't be nervous, don't be scared. If you hear something back the first time, that's typical. Okay, that's
Mhm.
typical.
Yeah.
This is what happened to me. I was scared and they said it was normal. Yep, Keisha, same thing, girl. Listen, when they called me to come back and have another one, I said, "Oh Lord, I got and I'm a registered nurse, and you know how I did. I'm going up there reading it, and that's when I seen what it was saying. I said, okay, good, good. Then my mother told me, and I'm like, you wait until after all this time to tell me. But it's still knowledge. Knowledge is power. The
Yes.
mind is a terrible thing to waste. Yes, God, it is. So definitely you want to make sure that. Hold on one second. So definitely you want to make sure that you're getting those mammogram tests when you should, and know that the screening is just to help. The screening is to look for any cancer early. That's the purpose of the screening, to try to catch it as early as possible. That's the purpose of it. People send hearts to the host, tap the screen. Oh, thank you, Leona. Look, she talking about something. I thought she was about to say something. I'm reading it like, thank you, love. I appreciate that. And so, and while Harvey, I know that you actually are breast cancer conqueror, and this is who. While Harvey coined that phrase, breast cancer, instead of saying breast cancer survivor, a breast cancer conqueror. And so, do you
Yes.
mind? Because you shared your story before, but just because of everything, do you mind sharing your story with us?
No, no, no. I don't mind at all.
Okay.
Um, hey everyone. My journey started back in 2017. I had just got married on January the 14th, and was diagnosed the first week of February. So went in, did the biopsies and everything, and it came back. The woman was like, well, it may take about 3 to 4 days before you hear anything, because it has to go through the lab and pathology and all of that. And I'm telling you, they called me the next day. They called me the next day and said, I'm sorry to inform you that it was cancer. But before I could even hear her, before she could even finish the word cancer, I just started screaming and just threw the phone. And my husband, he took the phone and started. God bless you too, Leona. Um, Took the phone and finished getting all the information and everything that we needed to do. The first, so we went through setting up, and they did a lumpectomy because that was my first time. They felt like, okay, we could get it, remove that.
So while Harvey, I'm
Oh yeah.
sorry to interrupt. Can you explain to people what a lumpectomy is?
Okay, a lumpectomy is when they go in and they remove the cancerous part and also certain margins around it to make sure, and check those margins around it to make sure that there was no cancer in that. Now, once they do that, say for instance, you're finished with the procedure and everything, and they send it off to pathology, and pathology see in the margins there was still cancer, then you go back in and they cut out more. But thank
Mm.
God when they did mine, they cut out the cancer and the area around it. And when they did the pathology, it didn't show anything in the margins around it. So after the lumpectomy, yeah, they're going to tell you your diagnosis over the phone. Yeah. If
Mm.
it's you and they verify it's you and all the information, yes, they will tell you that information. And plus, on top of it, they had already, when I talked to the doctor the day that they did my mammogram, um, they took pictures, set me in the room, came back, took more pictures. I'm like, okay, what's going on? They never took this long. All right. Then after that, they said, we're gonna go in here and we're gonna do an ultrasound. I'm like, what? Ultrasound? What's going on? So they did an
Mm-hmm.
ultrasound and they kept focusing. I just felt like, how they kept focusing on one spot. I'm like, what is going on? And I was back there for a while. So when they were finished, they said, we're gonna let you go to the room over here and sit, and let the doctor come in and talk to you. And I said, okay, well, can I go get my husband so he could be? So when I got my husband, we sat there and waited on him, and that's what he said. He said, we see something that looks a little suspicious, and I hate that word now. When people say suspicious, it just does something
Mm-hmm.
to me. And he said, so we want to do the biopsy to make sure. And I told him, I looked at him, I said, be honest with me. You've done this a long time. What percentage do you think that this is cancer? He said, I'm about 98% sure that's what it is.
Mm.
And so came back, like I said, that next day, and it was just, I tell you, it was a world of emotions that you just don't really understand. Because the first thing that you associate cancer with is death.
Right.
And that's the only thing that kind of just goes through your head, like, oh my God, what if this, what if that, all the what ifs goes through your head. But
Right.
after the surgery and everything, I did radiation and all. The next year, well, it was every 6 months I had to get a mammogram. So I would go back
Mm-hmm.
and get the mammogram. It was clear, up until almost 2 years to the exact date, and they found a second one, and that was in
Mm.
2019. And so, of course, when they started doing all that and taking extra long, and okay, let's go back here and do the ultrasound. I said, oh my God, I already knew.
Mm.
I just already knew in my mind, what was going on. And they did the ultrasound, went back there, talked to the doctor again, and he said, we see another spot that kind of looks suspicious. I was like,
Mm.
oh God. And I just, in that time, my husband didn't come back because I didn't know what was going on, so I just,
Mm-hmm.
last time they took me back there and said, oh, everything's fine, you're good. This time when they said it, so my husband was sitting in the waiting room, and he was like, hey, such and such, and I just ran past him. Just, I was just messed up, like, oh my God, second time. So that time the doctor told me, he said, I don't want to give you any kind of like false hopes as far as like saying, let's just do another lumpectomy. He said, I don't, you really can't save the breast. So you really,
Mm.
my, recommendations is that you get a mastectomy. And so, I prayed about it, and I was just like, okay, well, let's just do the mastectomy. And so, but after I really thought about it, I'm like, wait a minute. So if you take this one breast, then what about the other one? What if it decides to come in? Well, the chances of that are pretty much slim. And in my head, all I could think about was if if it came in this one, it don't have anywhere, then it'll find itself. That just was in my head, and I was just
Mm-hmm.
like, so I opted myself for a double mastectomy, and I got the double mastectomy and did chemo. Whew,
Mm.
baby, let me tell you, that
Mm.
chemo I thought was going to take me out because I was so sick. I was so sick.
Mm.
Um, it was it was just a rough time in my life. I couldn't eat. I just was sick. I just was sick. And then on top of being sick from the chemo, they gave me this little thing, like once you get chemo, it draws from your bones and everything. So they give you this thing that Neulasta is supposed to help with your baby. That's the devil. That's
Let me say
that's
that
the
again. Now what? So they what was the purpose of that? It was a medication, like a transparent.
they
Okay.
put this little patch. It's like a device on you, and then in 24 hours it goes off. It start giving you the medicine, and you hear the thing start buzzing. You hear the clicks, and it starts giving you the medicine. I'm telling you, it wasn't a good 4 hours after I started. I really got sick. I was so sick. I was sick, running fever. I went, I just
Mm.
thought I was gonna die. I'm telling you, I was so sick,
But
and
what
I
did they
kept
give
going back.
you? Why did they give you that? What was the
Well,
purpose of that?
they told me instead of me having to come and back up there and get a shot, that does the same thing, and it's supposed to help replenish the cells, like that are pulling from your bones to
Mm-hmm.
keep your bones and stuff, keep because they're pulling all the cells, white blood cells and all that stuff from your
Mm-hmm.
yeah. So and this helps supposed to help rebuild them. Well, baby,
Mm-hmm.
I was I was like, so I was going back and forth to the hospital. I was being admitted to the hospital. They were giving me IVs every Friday because I would be so
Mm,
sick. I would have to go in because I couldn't eat. So I would have to go in and they would, so they would double up on my steroids and everything.
mm,
Um, then my second dose of chemo, I had a reaction.
mm,
Girl, I could feel like I couldn't breathe. I've had the other one, so it was fine. She gave it to me. It started running, and she just went over there and sat down. And I started feeling this heat rise up.
oh
Just
yeah.
felt like my head was finna
Mm-hmm.
pop off. And I started getting
Mm,
short. I said, ma'am, something's wrong. Something's wrong. Girl, people from everywhere was just flying around, doctors and nurses running and getting these
mm,
boxes, giving me shots, giving me all kind of stuff, putting breathing treatments on me. They were doing everything, stop the
mm.
stop the chemo and all. So I mean, it was a rough time. Hey, lady, how you doing? It was
Hey,
a rough
hey,
time.
lady.
Hey,
Hey, Wah
Ansley, how
Harvey.
you
I
doing?
mean, hey, Ansley. I said, hey, Ansley. She said, hey, Wah Harvey. That's why I said that.
And so it was
Was
a
it?
really
Was
rough
it? Was she
time.
running it too fast? Was she running it?
Well, the thing is
See.
this: when they first give you your chemo, they start out real slow.
Mm-hmm.
Then they increase it a little bit, and then increase it a little bit until they get to the flow of where it needs to be during that session. Because that first session, I was there like about 4.5 hours. And so, said that happened to her in March. Oh my God, yeah,
Mm-mm.
I can believe it. And
Right.
so the next time, since I was able to tolerate it, they started it at the pace, you know, baby. I don't even think a good 3 or 4 drops must have gotten in me because I immediately started having a reaction.
Oh yeah, you had a
And
reaction there.
yeah,
Mm-hmm.
so they had to go in and stop that part of the chemo because I got two different chemo drugs. They will run one first, and then after that, fixed up the other one, and I'll gown up and put all that stuff on and put the other stuff, and then give me the other round of chemo. So I would have two uh, chemo sessions in that one time each time. And so
Mm,
that time I did not get that one because he said don't give it to her, just do the other one. So they
mm-hmm.
resumed the other one after they finally got me stable. But in my head, I kept thinking, okay, I didn't get all the doses of my chemo at the end. And so I asked him, could you put the one that I missed on the end just for my own sanity? You know what I'm saying? Just for my own
Right.
sanity, for me thinking like, okay, if something happened and it came back, okay, because you didn't get that one. It
Right.
just was in my head mentally. Yeah, but that was just a rough time in my life. I was really, really sick. I was very sick. And like I told you, you remember I kept telling you like there were nights that I didn't feel like I was gonna wake up. I didn't feel like I was gonna make it. It's
Mm,
just like I feel like death entered the room and I fought all night to stay alive. That's how I felt because I was so sick. And so I look at people that are way older than me that had it and how they battle. I'm like, if it's doing me like this,
oh
then
yeah.
can you imagine how a lot of the older women are tolerating it. But it gave me a more clearer understanding and a
Mm,
much more respect for women that went through it. Because you know you can't really sympathize with them until you really went through it. And
right,
being a nurse, you know they're sick, but you be like, you know, in your head, you be like, oh, come on. You know what I'm saying?
right.
You be like, I know you're not feeling good, you know, but I still do my stuff. But till I went through it, I knew exactly what they meant.
Yes. Mm-hmm.
When sometimes you can't even keep liquid down, or you can't take but a
Mm,
bite of something, or and so they had to put me on a lot of Ensure. They had to double up my steroids. They had to put me on all kind of stuff just to get me through the chemo. Yeah,
mm, mm,
so
mm.
it was pretty rough.
Yeah, well,
Yeah,
thank God you made it
and
over, Lord. My
thank
God,
you,
today.
Ashley. Thank you.
That right there, I would not wish that on anybody.
Oh, me
And
either.
that's why it's so important, especially and that's why I'm so firm because like you said, I went through a lot too, not anything like that, but I have been through things. And when you go through it, you do understand and can sympathize with people a little bit more. You know what I'm saying?
Mm-hmm.
But Lord have mercy, child. That right there is something else. So I'm thankful that you are a breast cancer conqueror. You see what I'm
Yes,
saying? And you made it through to tell your testimony to be able to help
yes.
someone else. Shoot, they probably had to give you Finnegan. Shoot, that Zofran is weak.
They gave me Finnegan,
Yeah.
IV. They gave me Finnegan and Zofran pills to take home. Plus, I kept getting
Mm-hmm.
infections, so they would give me antibiotics. So I was just going through a whole bunch of
Ooh,
things.
ooh, child.
Yeah.
Listen, I'm gonna tell you, them antibiotics and steroids are some powerful drugs. You know, there's some powerful drugs. That prednisone is a miracle, but it can be detrimental. You know what I'm saying with the weight gain, with your
Woo,
blood glucose, you know what I'm saying, and stuff like that. So,
girl.
but it's
I gained
definitely
so much weight, D.
mm,
Afterwards, not during, but afterwards. And it's like still now a battle to try to get it off once it's on,
yes, it
you
is,
know.
Ansley. Hmm. It
Yeah.
definitely is. It
Yeah.
because I have to keep that on hand because of my I'm allergic to so much stuff and I have
Hmm.
to keep it just in case I have any flare ups and stuff like that or whatever. But it's just amazing how much you go through with something like that. I knew a lady that was 70. The doctor gave her a double mastectomy. Now that was crazy.
And sex?
Mm, child.
Ooh.
Because child, mm. And a mastectomy is for the people who might not know. It's they remove the breasts. They remove both breasts. Double mastectomy is both. Mastectomy is one, but that's what they do. They remove the breast. But oh um shoot, but that prednisone, I think my body is used to prednisone because of how much
Hmm.
I've had to take because I had an anaphylactic. I almost was
Ooh.
gone to glory at one time from allergic, and I didn't know I was allergic to so much stuff. So I had to, I have to keep that on hand with the EpiPen and Benadryl and stuff like that. But definitely some things to look for in that is, again, remember y'all, the armpit, start at the armpit and zigzag. That's one area to look for any kind of new lump or breast under your arm, thickening or swelling part of the breast, irritation or dimpling of the breast skin. Also, like if you stand up and you bend over, look and see how your breasts are hanging. Is it pulling? Are you feeling like a pull? You know what I'm saying? When you reach your arms up or something like that, are you feeling kind of like a pull? That's something to look for too with that. Any kind of redness or flaking skin around the nipple area, that's also somewhere that's doing that. Look, the next thing say pulling in of the nipple or pain in the nipple area. Exactly. Any kind of discharge other than breast milk, including blood, and any change in size or shape of the breast, and pain in any area of the breast. Those are just some of the symptoms that the CDC.gov state to look forward to now look forward to. Lord Father God, rebuke thee. I rebuke that. Let me take that back. Let me rewind. That's just some of the things to look out for if, you know what I'm saying, some of the symptoms and that type of thing. And so, and also what I wanted to give y'all, I wanted to give y'all, hold on one second. I had it here and I done took it out of
Can I
the
say one thing?
Go ahead.
When I was diagnosed, I was doing my breast self checks and everything. I had no signs, no symptoms, no nothing. It was just a still small voice would wake me up at night and say, "Go get your breast checked." For about 3 months, and just I would wake up, and I know it was nobody but God. I said, "Go get checked." And it stayed on me, and you know how it just like that thorn in your side just kept nagging me till I like,
Yeah.
let me go do this, and I'm glad I did.
Yeah, I'm glad. Exactly. That's why I said any kind of pain, any kind of anything, get checked for men too. Because there is breast cancer in men, and I'm gonna read up on this right quick for men. It says about 1 out of every 100 breast cancers that's diagnosed in the United States is found in a man. The most common kinds of breast cancer that's found in a man is invasive ductal carcinoma. It's a few of them on here, y'all, and I do apologize if I'm saying anything wrong. You can definitely go to cdc.gov and put in breast cancer screening, and provide this information. But for men, it's three different it says, oh, it's the same, it's similar to the women, the type of different cancers and stuff like that it is for men. So definitely, if you are someone that has a history of cancer, have a history in the family of cancer, breast cancer, it's very important for you to let your doctor know that, and also to get checked out and find out those different age brackets. I will say that a man's risk for breast cancer is higher if a close family member has had breast cancer. So definitely for men, even that's the same thing. If you're a man and your mother, your sister, whomever, it is very important for you to also talk to your doctor about it. And don't be ashamed. I talk all the time about how to communicate with your doctor, how to build that relationship. It is so important. I've also talked about family history. This is how your doctor can tell you, okay, because if you got this going on, let's go ahead and start testing for this. Let's go ahead and start looking for that because of what you state on your family history. So even though, yes, it might be a whole lot of different check marks, a whole lot of different stuff, check it. Make sure you keep it up to date, and communicate that with your doctor. It's so important. It's really so important to do that. And so based on just as far as, let me see, based on the cdc.gov, also, let me go back to this because I want to talk about these ages right quick. The CDC recommends women who are 50 to 74 years old. Now, remember, y'all, this changes, okay? Because there was one time where I could have sworn it said in the 40s, okay? But this has changed. Now, I continue to get my breast exams because based on me getting my breast exams 4 years ago, it's a habit. And one thing about me, I'm a firm believer on getting your preventative screenings. I don't play about getting myself checked out, my annual. I don't play about my mammograms. Because I have migraines, depression, anxiety. I do not play. I go and do what I need to do, my pap smears or whatever. Even if you're someone who is not having intercourse, you still need to get your pap smears. Definitely need to get your pap smears. You understand what I'm saying? I'm also going to say this, okay? And I'm going to step away from breast cancer for just a moment, but it's on my spirit, so I need to say this. If you were someone who was having anal sex, okay, let's talk about it. You need to be checking for some things in that area too, women and men. I don't play. Now, this is me. There's only two exits: the rectum and your mouth. Your rectum, the purpose of your rectum is to release the toxics of your body, okay? That's what it's for. Bowel movements, the number 2. So if you are someone that is engaging in those type of activities, be sure to inform your doctor. Not only are you taking it one way, you're taking it another way too. Okay. And if you are a man and you're taking it that other way, please get checked up. Look, we're hardly looking to the right, but I'm just saying, please get checked up, guys.
Oh, no. I'm sorry. I was doing something.
Oh, you were looking at something? Oh, because I am going to have an episode of that. Okay. Because I do feel that these days, hey, Bruce, how you doing, love? Thank you so much, love. These days, the age of these children starting to have intercourse, bisexual, doing different things. Hey, if you like it, I love it. That's on you. I'm just saying, my whole purpose as a registered nurse is not to judge you, but to make sure you're going to get checked out. Okay? And it's just very important. Let me tell y'all, and I'm going to talk to Harvey. I'm going to talk to you about this too, Harvey, as well as some other people as well, because I really want to go deeper, take a deeper dive in this area here when it comes to sexually transmitted disease, or STIs, and stuff like that, and other things. I think it's very important that we have this discussion, and it may be uncomfortable for some people. And if it is, at that moment when I talk about it, y'all know you can always leave. I don't want nothing to trigger you. Even right now, if something is a trigger, please exit the live, okay? I never want to hurt, harm, or add to anyone's trauma, but that is going to be a different education that I'm going to talk about, and I'm hoping that I'm able to have some teenagers, with the help of their family, their parents and stuff. I don't want anybody underage up on here going ham, because I'm gonna have to execute to the left. But parents, you need to be having this conversation, because we're in a whole different time now. Okay. I'm gonna even go and say things like this always been going on, but with social media and things like that, it's more prevalent because of that. You see what I'm saying? So don't judge your children for what they want to do and who they want to do what with. Communicate with your children, okay? And then have that discussion at a younger age. That's what I'm saying, because these days the children is getting down on the get down. All right. They're exploring and experimenting. You got all kinds of stuff. All of a sudden, it's okay to have all these drugs to take and all this other kind of stuff that's going out. So we want to make sure that we got to save the children. All right. Educate the parents and stuff like that. So I'm definitely going to have something in reference to that too, because I think it's very important. But I'm going to get back on the breast cancer. But definitely, they recommend that you get your mammogram at the age between 50 to 74 years old. That's the average, every 2 years. Okay. Women who are 40 to 49 years old should talk to your doctor. That's what it say. Or healthcare provider about when.
Does it show when they change that?
It doesn't say. Let me see. It's the United States Preventative Service Task Force. This is an organization made up of doctors and disease experts.
Oh, okay.
Who look at research on the best way to prevent diseases and make recommendations on how doctors can help patients. They change up so often with the different years, because there used to be 40 something around there. I remember that. That's when I started doing it. You know what I'm saying? So they've changed that. But if you're 40, 49, they say to talk to your doctor. But women should weigh the benefit and the risks of screening tests when deciding whether to begin getting mammograms before age 50. It really is also up to you. Please talk to your doctors, y'all, whether that's your specialist, your primary care doctor, your your physician assistant, your it used to be, but they saying here that it's 50 to 74 now. It's recommended, the United States Preventive Service Task Force. But it's also there's some other organizations that's listed on here too. There's about one, two. Okay, the American Cancer Society says women age 40 to 44 should have the choice to start breast cancer screening once a year with. Yep, see, I knew I seen something. So the American
Yeah.
Cancer Society, I'm gonna go with them, okay? But I knew it had to be that. So there's about one, two, three, four, five, six, seven. There's 7 different guidelines that's out there, okay? The U.S. Preventative Service Task Force, they saying 50. American Cancer Society says 40. The gynecologist, let me see what they say. I don't see no age. Yeah, so between the 7, and again, you can find this on the cdc.gov breast cancer screening guidelines. It's about 7 organizations. Look like it's weighing between 40 and 50, but I'm gonna go with 40 because I knew I seen it somewhere. So I'm going with the American Cancer Society. And then it says women age 45 to 49, whereas the U.S. Preventative Service Task says 50 to 74 should get it at, be screened annually or every 2 years. But I'm going with the American Breast Cancer Society because that's
which one was the American Breast Cancer said, D?
The American, hold on one second. Let me go back to it.
I'm sorry.
No, you find the American Cancer Society says women age 40 to 44 years should have the choice to start breast cancer screening once a year with getting a mammogram if they wish to do so. The risk of screening as well as the potential benefits should be considered. And then it says women age 45 to 49 years should be screened annually. That's what they say. But I'm going with the American Cancer Society because I believe that's the one that I was looking at when I decided to go. So when I pulled that here. So yeah, so it's very important to definitely get those done. Get the mammogram test done. They do have the 3D mammogram, but this is where, see, if you've been watching me and been paying attention, I've been going over all this, your insurances and everything. This is where your insurance come in, okay? Some of them gonna go with the regular mammogram. There is a such thing as a 3D mammogram, but what you want to do before you get that 3D mammogram, because I'm gonna tell y'all something, the doctors don't always do what they need to do when it comes to getting you prior authorization on some things. Please check your benefits to see if 3D mammogram imaging is covered, because if it ain't, you gonna pay for that, okay? All right, because it's more expensive than just your regular mammogram that they would typically do, the basic one. All right, so if you want to have the 3D, that's perfectly fine, but please make sure you consult. I'm gonna say this as an overall thing because I've talked about this before as well when I was in a live with Lady of Suspense. You want to make sure that Hey Jay, how you do? I got your book, Jay. I got your book. Yes, God. But you want to make sure that you are verifying when it comes to preventative screenings that you are making sure you know what your insurance cover. Okay? When it comes to preventative screenings, you want to make sure you know what your insurance is covering for that. Some things are not always 100% covered, but you won't know that unless you actually are thoroughly reading over your benefits. And see, I'm on a mission. I'm going to always talk about that. I think it's important. Oh, you good, Ansley? I'm going to always talk about that. I'm going to always come on here and educate as much as I can and provide what I can and everything, because I think it's important, because there are a lot of people, again, who are not aware of their copay, of their coinsurance, deductible, don't know the difference between them, don't know what's going on with their benefits until something happened. Don't let something happen for you to then find out you can't do this or you can't get that. I'm going to tell y'all something else too. There are some employers that are offering like cancer packages and stuff like that for cancer. They get very specific, but it all depends on your employer. Okay. Your insurance packages is determined by your employer. I'm going to say that one more time. Your insurance packages is determined by your employer on what they want to offer their employee. They go out, they look and see, they talk to the partners, that could be United Healthcare, Aetna, whomever, and they come to an agreement of this is what I want. It's all about business, y'all. It's business. This is what we want. Well, if you get this, y'all gonna have to pay that. Oh, well, you know what? No, we not paying that, so we just gonna get this. You see what I'm saying? So before y'all go calling y'all customer service representatives and cursing them out because something ain't covered, you might want to go to your HR, your benefits department at your job first, because that's who determines what kind of insurance packages they're gonna offer and what they're gonna offer in those packages. All right. So definitely spread the word. Okay. So, but getting your breast examined is very helpful. Learning your own, examining yourself, ladies, is men too. If you have a history of that going on, examining yourself is the best policy to start that preventative. Okay. Again, you want to start in your armpits, up in your armpit. Okay. And you want to zigzag, palpate, and you want to zigzag, and then you're going to do the other arm. All right. And if you notice a difference, you're feeling something that's different. If you're standing up, I'm going to stand up and show y'all what I'm talking about. But I got my clothes on. If you stand up, ladies, and bend over, and as your breasts are hanging, if they looking like one is bigger than the other or something like that, or if you're noticing a pull, you understand? You're noticing something ain't right. Something going on. That's definitely when you need to be. Hold on, y'all. Let me close my blinds. That's definitely when you need to be reaching out to your doctor to let them know. Okay? That's definitely what you need to do. Reaching out to your doctor to let them know. People in the sky, y'all got the information? Anybody got any questions? People in the sky that you want to drop down and ask. Okay? People in the room. All right? This is so important. I will say, and I think Wild Harvey can agree, everybody can't be in healthcare. Everybody can't be a doctor. Everybody can't be a nurse. Everybody can't be a phlebotomist, a respiratory therapist, a medical assistant, what else? EMT, CNA, certified nursing assistant, 1-2, licensed practical nurse, everybody, a nurse practitioner, nurse anesthetist, the different variations of doctors. It is a special type of person who can deal with the population of humans. Okay. My God, today, humans get on my nerves sometimes, but I love y'all. Mm-hmm. My mother is a retired nurse. My aunt, all of that came and is in the family. I remember my mother used to come home and tell stories. And I used to be like, oh, no, I ain't never doing that. But God, you see what I'm saying? But God, all of a sudden, certain things didn't faze me like that. Now I still got my little, like I don't like a lot of spit. I don't like people spitting and vomiting and wounds. I don't do wounds. I'm sorry. And we're human, okay, y'all? So people who are not in healthcare, we are human. Yes, we signed up. That's just like somebody who decided to work at the drive-thru. Work at a fast food restaurant. That's your decision. We decided that we want to help people. However, we still a human. It's some things I'm not going to deal with. I don't like burns. I can't do it. I don't want to work with kids. I'm too sensitive. So there's certain things. And the beautiful thing about healthcare, you can go into different areas. You don't have to stay somewhere and whatnot. You understand what I'm saying? I'm in the process now of making some decisions with my nursing career because it's time for me to make a change. And yes, I'm nervous because when you've been doing something for so long in a particular area, you get comfortable. You know what I'm saying? But you also can get burnt out. But as a registered nurse, it is so much that I can do that I know what I want to do. I know what I'm going to be doing. Hey, unknown girl, how you doing, love? And so that's where I'm going to be going. I'm looking into for myself. But it's a lot, y'all. It's a lot we have to deal with in healthcare. Okay. It's a lot. So have some grace. Okay. The next time, just have a little grace, y'all, because especially COVID exposed a lot in healthcare. It's sad that it had to come to that. All right. But COVID exposed a lot in healthcare. And I'm going to tell y'all now, because I'm reading this book and I'm going to talk about it because I can. All right. This is a platform TikTok gave me to talk, and I'm going to utilize it the way I want to. If you want to learn about some of the things that's happened in history with African American people, please, y'all, get this book. Medical Apartheid. That's right. Apartheid. Y'all might think Africa. You might as well. Medical Apartheid, The Dark History of Medical Experimentation on Black Americans from Colonial Times to the Present by Harriet Washington. Let me tell you something. Reading is fundamental. The mind is a terrible thing to waste. It is nothing wrong with you researching and educating yourself to get the knowledge to understand things. Because I'm going to tell you something. Healthcare, you deal with racism, you deal with bias, you deal with cultural bias, you deal with all those prejudice, all that stuff you deal with. My first job as a certified nursing assistant was on the floor with prisoners, murderers, people who would sexually assault women and men, pedophiles. Okay. As a certified nursing assistant, that was my first job. All right. However, I couldn't go in them rooms and moving forward in my career when I dealt with someone who might have molested I don't even want to go too deep. But what I'm saying is, in healthcare, you can't go in there ready to do this and do that. You can't do that. You can't be God. Let me say that again. You can't be God. You are human to do God's work, but there's some things you can't do. Your job is to go in there, whether you want to or not, whether you feel a certain way or whatever the case may be, and still treat that person with dignity. That's hard for people to do. Let me tell you, I done heard conversations on the side. I ain't going in there, shoot, I've been undid this, I've been undid that. You see what I'm saying? No, you're not. Because that's not for you to judge and you to do. And it's hard. That's why I say this is a special thing. Everybody can't do. Everybody can't do it. Everybody ain't going to be able to do it. Or religions. I will say this. And before I do that, okay, Lady Smith, before I do that, I want to say thank you, Harvey, for coming and sharing your experience. And again, y'all, please go get your mammograms, ladies and men. Men, if you have someone close to you as a family member, you want to go ahead and do that. Women, if you have a history of breast cancer or cancer, anyone, man or woman in your family, please fill out your family history, communicate with your doctors to let them know. Okay, so they can better assist you and treat you and guide you. You see what I'm saying, with the tests that you need and different things like that. And please advocate for yourself, y'all. You got to speak up. Don't allow no one to talk to you any kind of way, but also you don't have to meet them where they at. You could still say what you have to say, but say it to where they're going to hear you and respond, and you get the reaction that you need to get the treatment that you need. I worked in the jail, same thing. You can't, I done been there too, girl. I done been listening. I done worked everywhere, child. I don't been listening. Girl. Let me tell you something. Everybody can't do the jail system. That's another one. But if you all want research, want more information, please, the American Cancer Society is a really good resource. The CDC.gov gives you a really good information about your screenings, when to get those screenings, what to look for, what to expect. So please, y'all, that's a creditable resource. If you have any other questions or anything, please consult with your family doctor, or primary care doctor, or specialist. And also, if you're going to do research, please research credible resources, okay? Because they actually do statistics and evidence-based practice to come up with the information they're coming up with. All right. But definitely, this healthcare thing ain't easy. It really isn't. It's not easy at all. You see what I'm saying? So that's why I'm saying, to work, and like you were saying, Leona, working in the jail, working and all that stuff, it's very hard sometimes. You know what I'm saying? It's very hard sometimes. But, but I will say that, in my career, I was bullied in nursing. I went through a lot. But it gave me tough skin. I'm Medina Taylor, the daughter of James Henry Taylor. Y'all know that. People in the sky, y'all know that, don't you? Yeah, y'all know that because I say it all the time. My God, today. But nursing wasn't easy. But I knew early on, as I was in the emergency room, I started off as a ear, nose, and throat circulatory and scrub nurse at Duke University. Yes, God. Okay. When I graduated, I had two specialties, the emergency room as one for being an ER trauma nurse and working for ear, nose, and throat into the residency program at Duke University. I did start off there. It ain't paying out. Went on to the ED. Okay. That's the first experience. However, the ED also was an area where I love psych. Psych is my profession. Well, Harvey, did you have a profession? I know you said you would eventually you was doing long-term care before you retired. Well, really not retired, but decided to,
Mm-hmm. I think, I don't know. I think the one that I loved the most was when I worked in maternity and then long-term care. Those were some of I love working with the babies now, newborn nursery. Mm-hmm. Yeah, I love it. So it's like three of them that I really love dibbling dabbling. I hated the ER. I hated med surge, but you had to get your experience, by working in them.
Shoot, girl, listen. I knew I didn't want to do med surge when I was doing my clinicals. I was like, I'm gonna be in the girl. I was like, this what I want to do. And by God, listen, I was the only one, y'all, out of my class. Yes, God, I'm proud of myself, who had two specialty under the contingency that I passed the nursing board. I had two specialty offers. I was the only one in my class. Yes, God. I helped girls in my class who I helped them I taught them how to interview, help them with their resumes, because a lot of them, I had been a CNA I was a CNA 1 first, and then I was a CNA 2, so combined 7 years before I went into nursing. So my sister taught me very well throughout the experience, so I knew what the questions were to ask, what they were looking for. I interviewed very well. Very well. You understand what I'm saying? So if you want some, I need to do that. Shoot, I'm gonna have to look into that, because I'm gonna tell you what I know. I teach you what the skills of interviewing. You're gonna get the job. Yes, God, today. I'm telling you, because I'm saying that because I know I interview wonderfully. My daughter was training at New Orleans Charity as an RN, experienced a gunshot from she got shot. God, dog. I'm sorry about that. Is she all right? Ain't that something? The things we do. You see what I'm saying? The things that we go through. Can you just imagine?
Her daughter got shot, or did her daughter experience?
She experienced a gunshot from the town. So somebody must have got shot, and then
in her town that she knew.
Right. That's what it was. Yeah.
Okay.
Mm-hmm. That's what it was. Yeah, I done had to. The patient. Okay. Yeah, I done had to treat a lot of gunshot wounds. I done had to treat people who I remember it was a guy hand got cut off, and they put the hand in a thing of ice so they could rush him to the ER to attach his hand, and stuff like that. Man, I'm trying to tell you. I done had a situation. I done told this story before where somebody was in the ER and he was experimenting, and he got the thing stuck in the toy.
Mm-hmm.
And it was vibrating, y'all. It was in him. He put it up there too far. And when he came in, everybody was like, "Oh my God, y'all gotta go, y'all gotta hear this, I gotta go see this." Like his ass is humming. You see what I mean? I'm just saying. It was humming, it was vibrating. Okay. Mm, mm, mm. That right there. That right there, it ain't funny,
Mhm.
y'all, but I'm saying that right there was an experience. His ass was humming. I mean, he was experimenting with himself. You see, so this is why we got to have these conversations going on with some things so that people can understand. Because that's a little bit too much for hard. I'm just saying it was real.
Oh.
It was,
Mhm.
I'm telling you, the ED, them
Mhm.
stories that y'all be seeing on TV. Let me tell you
Mhm.
something. Yes, the
Mhm.
not the ED on not the little the shows. I'm talking about the ED real life. Tony, hey Tony to the max. What's going on? Girl? How you doing? I ain't seen you in a minute. But yes, Lord, I'm trying to tell you what I know. Yeah, I wasn't one of the ones to remove it, but it was humming. It was humming. I don't understand it. Like you couldn't get enough. I'm gonna leave it alone. I'm gonna leave it alone. But I done seen so I done seen so much, but I love
Um,
Psych. Psych is my passion. That's my heart. I love Psych. Glad to see you too, love. Psych is, and even though I'm someone who's an advocate for mental health, because I do suffer from depression and anxiety at times, even though I love it, I just loved it. And the people, I wasn't one of those ones who treated, I treated everyone. That's the thing in here. I treated everyone. I didn't treat people like they was, if they was mentally challenged or mentally ill. I didn't treat them like that. However, I did watch myself because I'm telling you what I know. They some of them strong, especially when they're going through an episode. Some of them
mhm.
strong. You understand what I'm saying? Everybody can't. Everybody can't do that in psych. You know what I'm saying? But I love it. I love it. But everybody can't do that in psych. A nurse, and I told this story too. There was a nurse who it was a 14-year-old, and she went in there and she was talking to him all some kind of way. She was being real disrespectful with him. And one thing they teach us is that you don't turn your back when you're walking out the room. You walk backwards. You kind of walk, okay, then,
Mhm.
all right, as you're doing, what you're doing, you walk out like that. But you always, let me tell y'all something.
Mhm.
When you were working in psych, it's training you got to go through. You don't just
Yeah.
come and start. You do the regular orientation, but then they give you specific training to handle
Mhm.
mentally ill patients. Okay. I'm telling you, I've dealt with children that were 6 years old with schizophrenia. Okay. I'm talking about dealt with kids who are very mentally ill, psychopaths. It does exist. I'm telling you, it's amazing the stories. These children, even though they're young, they talking to you like they're an adult. It's
Mhm.
amazing. But you got to know it takes a special person to know how to handle that and deal with that because everybody can't deal with that. You see what I'm saying? So you got to know how to handle that. Now I did deal with children once in a while whenever they needed a nurse to go over there, but I didn't like going for P's ED. I didn't like doing P's ED. I just children is a whole nother vital signs.
Mhm.
Children, I can't do it. It's too much. It was already hard as hell trying to learn the adult anatomy in a different, you know what I'm saying? Children is a whole separate thing when they deal with the
Yeah.
children. That's why I just can't
Yeah.
do it. But when you work in this site, they train you to walk backwards out. Just always be in the proximity of the door. Always position yourself to if a crisis go down, you know how to get up out that room so you won't get
Mhm.
hurt. This person was so involved in trying to chastise a child that's not hers. First of all, you're a registered nurse. Okay? First of all, you shouldn't be trying to chastise. I think he had his TV up, it too loud. It was something like that. Y'all, she went up in there. Next thing I know, she turned her back and he beat her down and broke her arm. Broke her arm. Mm-hmm. Yes, God. There was another situation where there was a registered nurse who was a police officer, but he got out of that profession and became a registered nurse in the ED and psych. A patient was in a crisis, spit on him. he broke that person. He broke that person arm. Nursing life was snatched up. Yes, he did. See, when you were in, that's what I'm saying, y'all. So when I tell y'all, it's a special person, because if somebody spit on you on the street, let's be real here, it's going down. But if somebody spit on you as a registered nurse or in healthcare profession, you can't do that. You have to have enough restraint to catch yourself, because the natural human instinct is to probably bust them. You understand what I'm saying? Y'all see Yana Von Zant. In the meantime, let me tell y'all something. Your girl reads. Okay? Let me put that down. Hold on. Let me put that down in the people. I'm going to tell you another good book. Jennifer Lewis. This is another good one. I read this book about 2-3 times. That's what I be doing. I will show y'all another one, but somebody might judge me. Okay? But anyway. But I'm a researcher. I love to read. I love to know why. That's just my mindset. You know what I'm saying? Like I'm always curious and wanting to know why. And sometimes I be like, Lord Jesus, but it's helpful. I love documentaries and stuff like that. But you definitely have to be a special person, because these are just things that can happen. These are things that can happen. Well, Harvey, didn't you say there was a time when a family member called you in the room to give her mama some water or something like that, and the thing was sitting right there?
Sitting right there. But baby, that was a day. That was one of them days. I was like, okay, hold on a minute, and walk right out the room. Because my thing is, if you're sitting there and you can't even give your mom some water, but you got your call light on to give your mom, and you're sitting there.
Man, I'm telling you, the stuff, when I worked in long-term care, y'all, well, mama had some pajamas and they lost. Mama had a can of chicken noodle soup and now it's gone. Well, your mama shouldn't even have all that sodium first and foremost, but you gotta just find out what's going on, do an incident report. I'm just saying, people be ready to go up there and can you give mama a bath? Mama shirt dirty. Mama just ate. Mama just ate.
And the thing is, when it comes down in healthcare, and you have however many patients, and you can be in the midst of helping another patient, they don't care.
They don't care.
It's about, they'll tell you, I don't care. I'm talking about my mom. I'm like, okay, but their mama is just as important as your mom.
Right.
And I've had to stop and tell patients that, family, look, when I'm through with her, I'll come to your mom's room, but she's just as important as your mom.
Right.
I don't understand.
Right. They don't care.
They don't care.
Right. Right. They don't care. Even like now, I have some patients who will call me and say, can you find me a doctor? I'm looking for, you can contact member services on the back of your ID card, or you can go on such and such website and locate. I'm not here to do that. I'm not a personal assistant. Okay. Now you want me to provide you some education, I can do that. But that's the guidance. The guidance is contact member services moving forward if you want to locate a provider. And I recommend asking for 3. You see, I'm not about to get ready to do. I'm not. That's not. I'm not here to be the personal assistant. I'm here to provide education and assist you in managing your care, helping you to reach any goals that you have that you're trying to make for yourself. And that's something else too, making goals for yourself health-wise, whether it is losing weight, eating healthier, making sure that you're checking your blood sugars, making sure that you're getting your A1C checked every 3 months or every 6 months based on your doctor's discretion when it comes to you having diabetes. You know what I'm saying? Or doing your annual wellness visits and things of that nature. Let's get into the habit of making those some goals as well too. I know people want to lose weight and eat right and stuff like that too. But if you're someone who is suffering from a condition and you're not being compliant, let's make a goal that you're going to start going to these appointments. Let's make a goal that if you ain't always talking to your doctor or asking questions, you start doing that. Go ahead, Wahab. You can put the finger up.
You
Yes,
ain't
God.
got you ain't got to tell all my business though.
What?
But you had to tell all my business because I'm one of the worst patients. I'm a nurse, but you had to tell me like my business like that.
Oh, I'm speaking to you. I'm speaking to you. My God,
Yeah,
today. See,
yeah.
I didn't even know that, y'all. I didn't even know that. See what I'm saying? But it's the truth. We nurses, we are the worst patients. We
Mm-hmm.
are. I'm gonna tell you something. And I don't never tell people I'm a nurse when I go up in there because I want to see what you're gonna
Mm-hmm.
do.
Ooh, yes, ma'am. I do the same thing.
I want to see what you're gonna do. But see, I don't work at the local ED here where I'm at. So people that know me, they know. And you already know, I know who the CEO or whatever. I throw names. But I can't stand to have to say I'm a registered nurse just to get some respect.
Mm-hmm.
Just to get things to be a little bit more expedite. Okay? I know the hospital number by heart. Before Google, I used to call the phone numbers. Child, listen. I'm telling you. I'm telling you what I know. I don't play no games, but definitely, y'all, when overall, and if you have parents who need help, y'all help your parents. Help your
Please,
parents, Lord. Help your
please.
parents. You know, we got to have more respect for the elderly population. Now, I do sometimes go in on the elderly population on this app because some of y'all in the elderly population, or I'm going to say 30 and above, you're acting plumb fool. Okay? You are. But when it comes to healthcare
Mm-hmm.
and you got a parent who ain't doing too good, or you thinking they okay and they doing what they need to do, but they not. Check on and ask them sometimes. Get involved with
Mm-hmm.
that and having those conversations. Let's start having conversations about health. Let's make that a norm. Let's not always have to talk about what's going on in social media. Hey, hey, love, what's going on in social media, all this negative stuff. Let's start having some more enlightening, higher level conversations that's going to feed our mind, that's going to feed our brain. You understand what I'm saying? That's going to nourish our brain, stimulate our brain. Let's start having those
Mm-hmm.
conversations. Let's talk about health with your family. Okay, such and such got heart disease, such and such got this, or such and such got that. You don't understand it? Research it. Use creditable resources, .gov, .org, those type of things. Research it. Have those conversations. Okay? Look up your medications just to see what it is. See what I always say, pathophysiology, meaning what makes up a person condition. What's behind diabetes? What makes diabetes? What causes that? You see what I'm saying? Look those things up. Credible resources, though. All right. Don't start getting over here on these blogs and stuff, reading everything, because everybody love to tell their story and make it seem like everybody else is happening to everybody. No, it's probably just happening to you. So you got to be careful about doing that. That's why I always say credible resources, because it's evidence-based practice and statistics. And I do understand, as Black people, we have been experimenting on for forever. Again, get this book, y'all. I do understand. And so that's why I make it my purpose to intentionally focus on the Black community, okay, African American community, because we don't have these conversations like that. You see what I'm saying? Something hurting on you. What we're quick to do is use a home remedy. Sometimes you got to get something a little more deeper than a home remedy sometimes. Okay. And you don't want to home remedy your ass to the point where now it's down to the wire and now it's at the end of the road. I'm just saying. Because some of y'all will home remedy y'all asses down. Great grandma and grandpa said drink a little bit of bleach with some peroxide, gargle, spit, halt, cough, lean to the right. We got to cut it out. Okay? We got to cut it out. Because y'all know who I'm talking to in the sky. We got to cut out some of these remedies that have your ass slapped up with diarrhea in the hospital, wide, open wide, loose as a goose. Because you're sitting here listening to you sitting here listening to all this. Okay? Put a little bit of pig feet on the right side of your neck, put a Band-Aid, drink this. We can't keep doing this. You're gonna mess around and I'm trying to tell you. Then you go on to glory. God, for my God today. Father God. Then they finally figure out what happened. Because Tyrone or Rashika done listen to great home remedy that came all the way back. And now they slapped up, gone to glory. So that's what we're going to talk about at the funeral. We're going to talk about the remedies, the home remedy. So let's cut out the home remedy and let's try to go to the doctor. Okay? You got to trust somebody. Because you got to understand what was going on back then is totally different. We got a whole slew. Do y'all not see? We got all these new, not new, but older stuff coming back. Monkeypox and mumps and polio and all this other kind of stuff. So you got to be careful and be mindful and just go to the doctor and get checked out. My God, today. Thank you so much, Hardy. I appreciate it. My God, I'm catching that heart. I'm going to call this right here. The heart woman. There you go. Do it look like a heart? Why Harvey do it look like a heart? Your heart is on the left side, people. Your heart is on the left side. I'm going to need for y'all to know where your heart is at, because some of y'all sit here all up over here on the right. Ain't nothing over there but lungs. But you steady over here talking about love you. Not what you loving. Lungs? Your lungs is over here to the right. You got 3 lobes over here and 2 over here because your heart is here. I'm going to do it again. Do I need to do a dance challenge? I might need to start doing some TikTok challenges to get some of y'all to understand how to get some of this education in. Let's do this one called Know Where Your Heart At. Bam. 3 lobes. Oh, you see what I'm saying? What? Bop, heart. You see what I'm saying? Do I need to do this for the people? Because I feel like I do. Because I'm tired. You see what I'm saying, Hardy? Do you see what I'm saying, Hardy? I might need to start doing some educational health and wellness TikTok dances. Bam, the boop, boop. Where your heart at? It's right here. Boom, where your stomach at? It's right here. Where's your lungs? Bop, bop, bop. How many on the left? 2. You see, I might have to do all that. Because I'm tired. My God, today. My God, today. So I can, so that y'all can learn something today. Take something from this. Okay? Take something from this. My God, today. My God, today. Because I'm getting tired of it. It's foolishness out here. Let's start trying to get this together. And I might have to do that, Wahhabi. You down with it, Wahhabi? Who gonna be down with the TikTok Health and Wellness Challenge? I'm going to put it together. You're on mute. You're on mute.
I'm with you.
You down there? I just started to show some love. You waiting on this. I got you. Hardy. I'm gonna tag you in it, Hardy. I'm gonna tag you in it. DC. DT is what's gonna say. Y'all know how they had DC and Nicole and whatever. And I'm gonna get this dance going. Going down, heart, doing to the lung, lobe, next lobe. You see what I'm saying? I'm gonna do something. My God, today I think I'm gonna use the whispers though, because ain't nobody did a remix of the whisper song, and the beat goes on, bam, and your heart is here, and it beats, bop to bop, boop boop. You see your lungs, 3 lobes over here, 2, and then your heart, and the beat go on. That's gonna be the challenge. And the beat go on. Your heart is beating and it's going on. My God, today. That's going to be it. You see how I came up with that? Read. When you read, you can come up with things like that. You see that? When you read, you can come up with stuff just like that. Just like that when you read. Things come to you. The beat goes on. The beat goes. The beat goes on, and then you're gonna have to do the beat like that. Harvey, the heart gonna be here. The beat goes on. Beat goes on. Beat goes on. See what I'm saying? I'm gonna get it together. I'm gonna put it together. Okay. Look at Joseph. Look, you done came
Oh
in.
God!
My
Oh
God, today.
Lord!
I'm just saying. Okay. To my hello, ladies. Hello. Hello. Yes, God. You came in just in time. You came in just in time. Okay. So let's try to work this out. You know, I'm definitely gonna work on the dance challenge. Y'all know how I am.
I can hear him laughing in here, D.
I'm gonna get this together so we can start having more meaningful conversations about your health and wellness, okay? Same way you putting all that effort and mental effort into all this mess going on out here in the social medias in the world. Let's start having some meaningful conversations. It starts with you. It starts with you to decide you want to do something different and you ain't sitting here trying to run and race after popularity. You understand what I'm saying? Stop trying to be so popular with stuff because you want to be viral and popular with God, all right? See, now I'm about to preach. I'm serious, y'all. You want to be viral and popular with the Lord, okay?
Mm-hmm.
Stop trying to run all the time and want to be popular with the wrong being. Do y'all know everybody ain't praying to the Lord? Everybody ain't praying to the Lord. That's why I don't need everybody praying over me. I have to pray over myself. You understand? That's the over right there. You got to pray over yourself. See, my daddy used to do all this stuff. He used to talk with his hands. That's why I talk with my hands. Because that's how my daddy used to be. My daddy used to be like this. He'll say something. He'll say, and you must. It take my daddy a whole 2 hours to get 4 words out. But I love him because he made me. I'm the daughter of James Henry Taylor. That don't take me no 4 minutes to get no words out, okay? But it used to take him 4 hours to get some words out. But what he had to say, woo, was on point. When he was telling a story, y'all, because you know he was known for with the guys and stuff like that. When he would tell a story, everybody, y'all, just circled around him just to hear them 4 words. You understand what I'm saying? But the story be good. The story be good though, but everybody be sitting there like, dang, and I just used to be little looking and seeing it. So when me and him used to talk, that's how it was. And I'm so, God is good, y'all, because I have now come to the acceptance of my father passing after these last, it's going on 5 years next year. I used to couldn't hardly say much. And while Harvey contested his, Ansley contest, Lady Butterfly, Lady of Suspense. Some of y'all can contest to this. I used to couldn't come on here to hardly say my father's name without crying. It was so hard. It was so hard to come to that realization. So for me to now think of the good times and talk, y'all, this is growth. So if you are someone who lost a loved one, and it's hard, I'm telling you, it is. I can't tell you when to get over that. Sometimes you never get over it. You just learn how to manage it, but you learn to accept it. You got to get through the grieving phase. It's a phrase for a reason. Some of us get stuck, and I was stuck for a long time. I was stuck in that bargaining. I was stuck in that what if. But once I moved on to that, and Harvey was one of the people that said, they're in a better place. You got to know that they're in a better place. And coming to that realization, going to counseling, that's something else, y'all. I'm now able to do that. I'm no longer stuck in that moment with that. I've come to that stage of I accept, because you know what? He's watching me now. He always is here. He here right now. You good, you good, Ansley. So definitely, if you're someone who might feel like, Lord, I'm not going to make it, I'm not going to be able to get through it, I'm not going to be able to not. If you are someone, trust me, it will get better. Keep praying. Now, this is for those, because I do respect there's everybody may not pray to God or may not have that belief of the Most High and stuff like that. I understand that. So this ain't for y'all though. This is for the ones who do. I'm just being real, okay? No disrespect. But if you are someone in this room, in the sky, it's going to get better. But you have to come to the point where you want to finally move on. See, when you're going through the grieving phase, and you're going through the different phases, you also have to be cognitive ready to go to the next one and go to the next one. And you may not go through the same ones in order. See what I'm saying? You might not go in them in order, but you got to know how to move on. You got to move on from it. Even if you're someone that lost a job that you done been on for 25 years and you grieving. You done been in a relationship, not just married to someone. It was in a relationship, a friendship, any kind of ship. Anything that you've been through, you can grieve for it. It is a better day. But you have to go through. You got to take your time. You gotta be willing to cognitively say, I gotta accept this, Lord, and I'm ready for you to help me get through it. Okay, you got to be willing to do it. You can't stay. You don't want to stay stuck in that moment for so long, y'all. Life is, and I'm somebody who I'm learning how to use my own words for what I say and maintaining my mental balance, with the balance mentally and physically and spiritually in alignment and stuff like that, because that's why y'all ain't seen me for the last couple of days, because I had to take some time to myself. Plus I was cramping like hell. I'm just saying, Lord, forgive me. Kind. Boy, I'm trying to tell you, God, I don't know. I feel like all the ancestors that had a menstrual, I'm going through I'm feeling everything. I'm feeling everything. You already know, y'all, they ain't had no kind of stuff to help out. My God, today I was so nauseous and just cramping in my stomach and my back. I know this might be too much, but it is what it is. Kind. Somebody cramping right now in the name of Jesus. Somebody in the sky right there. You, girl, you cramping right now, my God, today. Help her, Lord. Help her, Lord. Help her, Lord. My God, today. Help her. Help her, Lord. It's going to be all right. Get you a heating pad. And stop getting these raggedy heating pads. We got to start investing in some things, y'all. People, you listen, y'all done started. Y'all got me started. I said I wasn't going to be on here too long. We got to start investing in better things. Sometimes when it comes to heating pads, don't get no heating pad that's going to burn your skin off or it don't automatically cut off at a certain time. Stop getting these heating pads that you put it on high, stay on high all night. All night. Then you wake up, you're sweating in your stomach, you're sweating and all that because the heating pad don't go off. You need to get one that's going to go off after a certain time so you don't burn your skin. Okay? That's what I need you to do. All right. Good night to you too. And if you ain't got no or put a towel over it, around it, and whatnot. And drink a lot of water if you drink a lot of water, really we ain't supposed to have so much cramps and stuff like that. We ain't supposed to be, you really, I'm gonna say this and then I'm gonna wrap things up. I want to say this about menstrual. Your menstrual shouldn't be 9 and 10 days and 5 and 4. It's all based on what you eat, and you got to drink a lot of water. If you do that before your menstrual come on, I'm talking about some weeks before your menstrual coming on, you will have a better menstrual. You won't cramp as much. You may not bleed as much. Now, this is for those who may not be suffering from any other thing like endometriosis or other types of things that might be causing you to have this Lord, what's it called? Pain, cramp, dysmenorrhea. Y'all don't quote me now. It's something like that. But it's something like that. Now, don't quote me. Kind. Start with a D. Look it up. The one that you don't have no period start with an A. But look it up. Y'all know what I'm talking. You know what I'm talking about. Credible resources. But all I'm saying is, if you eat right and drink a lot of water before your menstrual, that will help you during your menstrual. Now you still may have the PMS, the headaches, and all that kind of stuff. It's just that this one, boy, I'm trying to tell you, because I wasn't eating right. I ain't gonna lie, I wasn't eating right, wasn't drinking a lot of water, and it took me through. It took me through, Lord. And I was so nauseous on Mondays. So nauseous. But I'm glad I'm feeling better. My daughter's birthday is this weekend, October 22nd. We're gonna have a good celebration for her. She probably gonna see this because you already know, what I put this on my Facebook and YouTube. I gotta put the other one on YouTube too. But her birthday is coming up and I can't wait. We're gonna have a ball, we're gonna celebrate. Y'all know, she lost her father last year before she graduated. So, this is her first year without celebrating with her father. And a lot of her family's going to be there and everything like that. So, but we're going to keep everybody in good spirits. Thank y'all for coming in. Welcome everyone. We're going to keep her in good spirits and we're going to have a great time and celebrate life because he is still living within her. He is still living within her. Yes, God. And, and I'm gonna tell you too, and some, talk to your family. Talk to your family that's passed. They there. I do it all the time. All the time. I talk to my father. I talk to my daughter's father. I sure do when I have to. I talk to some of the ancestors I don't know, but I know they're there. Shoot. Because they're the ones that got to pass down these home remedies that some of y'all using and whatnot. Sick of alcohol peroxide. I don't know why the family think alcohol peroxide is the key for everything. That's alcohol peroxide. And put some Vaseline on burns. Please, y'all. If you got doctors, go to your doctor. My God, today, and stop calling your family relative that's nurses asking them questions because we get tired of it. I cannot clinically diagnose you. I can only provide a nursing diagnosis off of the medical diagnosis, which is designated from the doctor for their prognosis. And then we treat the symptoms. That's what we do. We just treat the symptoms. We can't diagnose you and all this kind of stuff. Please go look up WebMD, go to the doctor or something. Okay? Stop calling us with all this rhetoric with my this and this and this and all that. I can't do nothing for you, man. Okay? I can't do nothing for you. Who said that? That was what's his name? God, what was his name? In NWA, not NWA. God, what was his name? With the clock, Flavor Flav. That's what he said. I can't do nothing for you. Okay. Yeah. Go to your doctor. That's what your doctors and stuff are getting paid for. You ain't paying me. Now, then if I start asking for a fee, then I'm going to be the one y'all going to talk about at the next cookout or for Thanksgiving. See what I'm saying? I call her and then she going to tell me she going to charge and this and that. See, that's what I'm saying. We could prevent all that and just have unity and be fake and phony at the family, because some of y'all know y'all getting ready to go to these Thanksgiving in Christmas. Y'all about to be fake as hell. Excuse me, Lord. But y'all know what it is, but you're going to eat good. Okay, you're going to take your plates and wrap it up in aluminum foil and whatnot and have about 5-10 different aluminum foils. Y'all know how we do. Okay, somebody gonna bring the cake from Food Line or Publix, act like they made it. No damn well it's Publix. Somebody gonna bring some Church's chicken. It's always somebody who got to go on who gonna bring chicken. Hold on one second. Let me get my water. Woo. Yes, God.
Welcome in, everyone. Welcome in.
I got my water. So that's all I'm saying, y'all. Get yourself together. That's all I'm saying. So again, make sure you get your mammograms. Just get your preventative screenings all together. Communicate with your doctors. This earring keep rolling off. Communicate with your doctors, your nurse practitioner, your physician assistant, whomever. Ooh, I done broke. Did I break my earring? Well, we're doing one earring right now, y'all. We're doing one earring because this one I think I done broke. And this and make sure that you're communicating with your doctors and stuff like that. Excuse me, y'all. So yes. And then any last words, Harvey, before we leave the scene?
No, I'm just like you. I just really ask all women, men, and especially, women, if you've gotten to that age, or men who had close family members who have been diagnosed with breast cancer, get your screenings. Please, please, please. You are talking to a two-time breast cancer conqueror in Jesus' name. So get your mammograms, get your checks done, get them done. If you don't have the insurance or anything, they have programs, right, Dee, and stuff
Mm-hmm.
that will help you to get your mammograms. Yeah, please get your
Mm-hmm.
mammograms done. Please get checked.
Yes, they definitely do. And they also have the mobile bus. And sometimes that comes in different cities and different areas and stuff like that. Always just, again, credible resources, but always um you can always look at like the American Cancer Society. That's a good place to start, because they'll be able to provide certain things for you, like
Mhm.
transportation, a case manager, communication with different things or whatever, not just for breast cancer, but any cancers. Also, lodge, meaning that if you have to go somewhere and travel to see a
Yeah.
particular a specialist, they'll pay for those, for their hotel stay, or where they'll put you up. It's kind of similar to what they do with St. Jude. St. Jude, they do stuff like that. But like with the American Cancer Society, they'll put you up somewhere, and check with your local hospital. You will be surprised the programs at your local hospitals. I know UNC Chapel Hill, that hospital, they have a program for cancer patients. And if you're coming to get treatment where they are, whatever the case may be, in that area, they actually provide but you have to contact the hospital for those resources. So this is the reason and the purpose of me doing what I'm doing, because I want to, as a case manager, that's what I do. My goal is to find resources for patients in different variations. My job is to build relationships, not just with one doctor, but multiple doctors, multiple information. My goal and my purpose is to know what national resources are available. If one of my patients call me and they out of state, I got to know, okay, where you can go, how you can
Mhm.
get this medication, how you can do this. So this is what I mean by, as a registered nurse, I manage over 100 patients on top of me having a business. And I still, because of God giving me that push and saying, this is what I want you to do, I come on here to educate y'all with a few of my friends who also can provide information, who also can provide testimony, because it's needed and it's given. You see what I'm saying? It's not a secret what a lot of stuff is. It's just you got to know how to do the resources and how to ask. You understand? For the information, okay? And definitely be serious about your health. Get serious about your health, mentally and physically. Serious about your health. Okay, most definitely. Thank you so much, y'all. Thank y'all for the roses. I mean, for the gifts, and thank y'all so much for following me. I appreciate it so much. I got a little. What's that? A new one? Okay, then
Yes,
TikTok.
it's a new one. I know.
Yes, God. I know that's right. Yes, Lord. I appreciate y'all so much. Okay, because I be wanting. Hey, Nikki. I be wanting to make sure that what I'm saying, I'm providing this type of information because it's necessary and it's needed. And also, I think as a lot of times, sometimes you don't see representation of yourself in areas, okay, meaning in healthcare. So I like to help people with communicating, whether you see representation or not. It's still a way you got to communicate with your doctors,
Mhm.
okay? And stuff like that. But also I want to be able to be that representation. So if somebody is watching me who could relate because they look like me, and when I say that, I mean, black or whatever, stuff like that,
Right,
that you would,
right.
be comfortable enough to discuss questions or ask questions and be able to provide information and trust, what they say. Like I say, I have to be ethical. I have to be. I'm a registered nurse. That's what an oath. That's the oath that we took. Just like the doctors take the hermetic, whatever the hermetic or whatever it is, we take an oath too. You know what I'm saying? So we have to make sure we're providing credible information. So whenever I come on here and provide information, trust and believe, I'm always going to give you the resource, and it's never going to be something that I'm saying, no, I can't, I couldn't do that. I have to go by evidence based. Have to. Okay. And if you want to know what that means, look that up. Look that up. But definitely, you know, I appreciate everyone. I will say this. Thank y'all so much. I got to say thank you. And I did a video today, but I have to give a thank you for y'all for supporting my businesses. I appreciate y'all so much. You know what I'm saying? And regardless, if you don't purchase, if you don't share, whatever that may be, thank y'all so much for doing that or whatever. You can look at my link. This is one of the sweaters that I have on there as part of my labels collection. I have much more to come as well too, and I'll be adding those as I go along. But thank y'all so much. I appreciate y'all for checking it out. If you look at my bio, it's a link tree. It'll give you my YouTube. It's gonna give you my Facebook page, Instagram, where you can follow me for all those areas. She Say, He Say Boutique. And then the last one is shop at SheSayHeSay.com. Take you straight there. Okay. Remember, with Shop Pay, you spend over $50 with Shop Pay. You'll be able to make 4 biweekly payments if you choose to. And if you want to know more about Shop Pay, as doing the checkout, there's a blue hyperlink that says learn more. Click on it. It'll provide you the information, and hopefully you'll make the right decision to go ahead and purchase in the payments, or just purchase, out. So I appreciate y'all so much. People in the sky, this go to y'all too. Thank y'all so much, because I know some of y'all have also supported me and been rocking with me. And like I said, everybody don't have to come in the room and stuff like that. That's cool. I'm always still, y'all, listen, y'all are thebomb.com too, okay? So I appreciate it, definitely. And thank you again, Wild Harvey, for coming in, and everyone coming in the room who've been in here or left and gone and came back. Or while, thank y'all so much. I'm getting ready to go, y'all, because again, I got to get my rest, okay? It's everything to me. And, I'll probably be back on here a little bit later on in the week. We'll see. But other than that, y'all have a great night. God bless. I wish everybody peace, and give yourself grace. Remember, love yourself, okay? Yes, God, pray, meditate, and all the other Asians. I don't know, that don't rhyme, but you know what I'm trying to say. All right, then. Love y'all. Love y'all. Peace and blessings. Bye-bye.
Bye-bye.
Bye.